Welcome to Golden Isle's Center for Plastic Surgery here on St. Simon's Island. Today we're going to be talking with Dr. Diane Bowen about a new non-invasive procedure called the YLift. Stay tuned as we meet Dr. Bowen and her patient Penny. We'll see some amazing before and afters. It's all coming up next right here on Golden Isles TV.
Thanks for coming today. Tell me what are some of your concerns that are bringing you in to talk about facial rejuvenation.
Okay, I'm really concerned about the lines around my mouth.
Yes.
And my neck. It seems like my skin is getting loose around my neck.
Yes. So, when we're looking at your face, certainly we can see some of these signs of some aging, which is some fullness down here in your, we'll say, the jowl or cheek area, which leads to some of this shadowing. And so one of the ways that I look at someone's face is I'm going to look at basically three components of a face. So we're going to look at the structural elements, which is how your face is supported by your jaw, and how your lips are part of that story. We're going to look at soft tissue, and then we're also going to be looking at the quality of your skin. So we're going to start with skin. So any time and effort that you put into skincare, at the earliest age, bears fruit down the road. So it's important that we all have a good skincare regimen that we're consistent with. It's basically nutrition for your skin, just like food is nutrition for your body. So, and then there's some technical things that we can do, some technologies to help improve skin. Those are things like Fractora, Lumeka helps with extra hair, and then microneedling and radiofrequency. For the soft tissue, so that's going to be the area right around your mouth. Those are going to be things like fillers, including, and then for the frown lines, we would use Botox. Okay, so looking on you, this is a great area for Botox, which is where your 11s, your frown lines are. Botox can be certainly used in the crows, where your smile lines are on the sides. And sometimes we'll actually use Botox to help with this muscle that pulls the corner of your mouth down. And then sometimes we'll use Botox in the neck area where you have banding of that muscle called the platysma. And then the last element of facial rejuvenation, which we're going to focus on today, is the structure. So as we age, we all lose structure, especially in the angles of our jaw. Our eye sockets get bigger, so we lose bone around the eye. So that's the reason why people look like they have sort of saggy or puffy eyelids. And then we also have aging around our nose. We have bone loss around our nose. And so what's called our midface sort of sinks back, and then that lets things to sag down. So up until I started doing the YLift, the only really two areas that I could address was skin surgery, as you discussed, to make things tighter, and then doing things, the soft tissue to fill up lips and do Botox. But the YLift is a very innovative way to use filler to replace what we lose in structure. And so we can use, and I have a before and after of another gal, so you can see that she had the same thing, this sort of jowly look, sort of downturning around the mouth. She had lost some of her jaw structure here. And then you can see sort of a hollow-eyed look, needing some replacement of that structure there. And so what we did was a YLift. We put replaced structure along her lower orbital rim, which is along the lower lids, so it's not so hollow. And then we replace the structure along her jawline, just giving her stronger jawline. And then we finish that up with doing some filler around her mouth and her lips to soften those, because that's what time does in general for women, is it tends to make us look more heavy, more masculine. So brows come down, lips thin out, and the corners turn around. Okay? So I think for you that a YLift is a great place to start to replace some of these areas of structural loss along the angle, up here in the jowl area and underneath your eyes, and then finally to use filler for soft tissue replacement around the corners of your mouth, what's called the marionette lines, and your lips.
That sounds great. It's exciting.
So the YLift does not involve anesthesia. It is filler. Now what makes it unique in its application versus other fillers like around the lips is that we're actually placing, so if this is your jaw, if we're looking at the edge of your jaw here, here's your chewing muscle, your masseter, we're actually placing that filler next to the bone here. And so by placing it next to the bone, that's how we're able to get the filler to mimic structure. When we put filler around the lips, obviously there's no bone in your lips, and so we're using the filler for softness, we're not using it for structure. In the family of fillers, we have fillers that are for replacing soft tissue, meaning around the lips and the mouth, and we have filler that's different, that's more structural, that we would use in those areas, and that's called Voluma. We will not be using a needle, and we will be using something called a cannula, and a cannula is a long slender device, and it's blunt on the end, sort of like this pen. And so I can tap this paper all day long with this pen, and because it's not sharp on the end, it's not going to pierce it. And so that's part of the safety factor, and it also reduces some of the discomfort because you're not having 1,000 pinpricks of having filler placed. The recovery is relatively brief. You basically have little portholes, a little where I get the cannula in, and those seal up within 24 hours. Most people do not have bruising, but that's always something. If you're easy bruiser, that's something to take into account, and we would probably look at doing some arnica, either cream or tablets. And I would say for about the first 2 or 3 days afterwards, your mouth, when you use it, is going to feel a little bit awkward if you try and take a big bite, because we've put that filler between the muscle and the bone, and that muscle then is a little bit stretched and a little bit swollen. So you want to take little small bites. And that's pretty much about it. You'll see the results instantaneously. And this gal right here, this is literally right after we got done. And you can see, her little portholes, but you can basically, that is her final result. So it's quite an innovation in the use of fillers, both because it uses the cannula and because we're able to replace structural elements.
I'm excited about it.
Yeah, I'm excited too. It's been quite a fun thing to do, because I can get results with this that I was never able to get with surgery alone.
Right.
Yeah.
And to see it right away.
Yeah.
Is very exciting.
Well, sure. Yeah. We all like that.
Yes.
Hi, welcome back to Golden Isles TV. We're here at Golden Isles Center for Plastic Surgery at Dr. Bowen's office, and I'm here with Penny, who's actually going to have a YLift procedure today, and we're so excited to talk to you about that.
Thank you. I'm excited too.
How are you doing? How are you feeling?
I'm very excited about it. I'm anxious to see the results.
Right. Well, what made you decide to have the YLift procedure?
Well, I have been aging, as we all do in the last few years. When I turned 40, I started taking care of my skin. I wish I'd started sooner. I use premium skincare. I was very happy with the result, but in the last few years, I've seen some changes that I'm not that happy with. I'm 55 years old. I don't feel 55. I hope that maybe I don't seem 55, and I want to just age gracefully. So when I heard about the YLift, I was very interested. I came to a talk that Dr. Bowen gave here at her office, and what excites me about it is they don't put you to sleep. There's no injections. There's very little recovery time. Usually right away you can return to your normal activities. They do use a local anesthesia, but it's all injections. And Dr. Bowen has talked a little bit about it's not a typical needle, it's a cannula. So it's not damaging the cells as it goes in like a needle does. So everything about it seemed very exciting, that you didn't have to go under the knife, because I didn't really see myself ever doing that. So when this was an option, I didn't know at 55 I would be doing this, but I'm very excited about it.
Right. Well, you already have a great understanding of the YLift, it sounds like. You know what it's all about.
Right.
And the important thing, it is non-invasive. And as we
Right.
talked about before, you see the results immediately.
Yes.
It's not something you have to wait for. You can go back to work or go back to your
Right.
usual routine.
And even go back to exercising.
Isn't that great?
Yeah.
Yeah. It's innovative and a fabulous procedure. We're
Right.
so excited to see your results. We're actually here with Penny before she's had her consultation with Dr. Bowen, and
Right.
we're talking to her before the procedure, and then we'll show the after pictures as well. What brought you to Dr. Bowen's office?
Well, I have heard about Dr. Bowen for years. Her reputation precedes her. I am a teacher. I've been a teacher for 33 years. I also work in skincare. I've been a skincare consultant for about 8 years.
Wow.
And in both of those jobs that I do, I come in contact with many, many women and men as well, but mostly women. And so many of them have had procedures done by Dr. Bowen. So I'd always heard about Dr. Bowen. And what I loved about hearing all these stories about her is that she is a perfectionist. She wants everything done just right. And in addition to that, she wants it to be natural looking. She doesn't want you to leave her office with duck lips or, looking unnatural.
Right.
And that's very much the way I feel. Where I don't want to look 55, I also don't want to look 25.
Right.
I want it to be very appropriate. So I met Dr. Bowen. I've had some other procedures done here, and I've been very pleased with her and her staff. Everybody just makes you feel so comfortable, and they are really out for their patient. When I'm here, I feel like it's all about me. They care very much about me and what I'm desiring and what I want done. And I was thrilled the first time I came and met her staff, and I wouldn't go anywhere else.
Absolutely. It is such a comfortable environment, and she does such a great job. And
Yes.
like you said, she's a perfectionist, but at the same time, really cares about you.
Yes.
And that really shows.
Yeah,
So,
I agree.
well, thank you so much for
You're
being with us
welcome.
today, and we're so excited for you, and good luck with the
Thank you.
procedure.
I thank you. I look forward to seeing y'all.
So today you have a patient, Penny.
Yes.
And you're about to actually do the procedure on Penny. Tell me about that.
So Penny, right now, we've kind of gone through the process of making sure that she's an appropriate candidate for this, and she is, because she has nice basic structure, which we're going to build upon. She does not have a lot of extra skin, and her age range is perfect, and her expectations are reasonable. And so what we will be doing with her is what we described, which is we're going to be using that filler and we're going to be placing it under the muscle next to the bone to basically restore her jawline and to make her look less hollow. And that will help to lift her cheeks up as well. And then we're going to do some softening around her lips. And she should, with that, should have a very subtle rejuvenation, and she'll be able to see it pretty much instantly.
We're excited. I know Penny's excited, and
Yeah.
we can't wait to show the after.
Yeah.
Stay tuned. Coming up. Welcome back to Golden Isle's Center for Plastic Surgery here on St. Simon's Island. Please join us as we meet with Penny, and we're going to see her after results. She's just had a YLift procedure, and today we get to see how amazing she looks. Stay tuned. It's all coming up next right here on Golden Isles TV. Hi, welcome back to Golden Eyes TV. I'm here with Penny. We're at Dr. Bowen's office today, and she has just had the YLift procedure, non-invasive procedure. It's very innovative, and you look amazing.
Thank you.
And we're so excited to be with you and talk about the results.
Thank you. Well, I'm very excited. It's been 1 week today.
Okay.
I'm thrilled with the results, and I can really see the results in the befores and afters. I have been with friends this weekend, and so many people commented, "What have you done?" or "You look great." So they couldn't quite put their finger on it, and I really liked that. So it wasn't dramatic like maybe a facelift would be. But I'm very happy with the results. There was minimal bruising at first. Of course, I used the Arnica plus K, and that took care of the bruising. And a little bit of swelling. I used ice the first day. But I've been doing my normal activities, going to the gym, the grocery store, just doing all those things that you do, cleaning the house. And I am very, very pleased. I'm very excited about it.
Good. Well, like I said, you look amazing.
Thank you.
And it's such a great procedure. Tell me about the actual procedure.
Well, when you go in, Diane numbed me a little bit with just a local anesthesia so they don't put you to sleep. I did take a low dose Valium about 30 minutes before the procedure. They go in, just like Diane explained last week, with a cannula, which is not really a needle. And the good news about it is it doesn't puncture your cells, which causes lots of bruising and swelling. It kind of pushes them out of the way. So I did close my eyes, so I was not watching. But she, she would go in, and she would tap. I'm not sure what if she was tapping on my face or if she was tapping the cannula, but she would tell me, "You're going to hear some tapping." And she would tell me before she went in. And it didn't last very long. I want to say 45 minutes to an hour. We did talk some in between, so it may or may not take that long every time. And then she would move, to the next section. And it was great.
Great. Yeah, I think you have a good point about it's a natural result. It's not something that people are going to stop you and say, "Oh my gosh,"
Yes.
But it's very natural, minimal bruising,
Right.
and non-invasive. So it's just
It's
wonderful.
perfect.
Yeah.
It was perfect for me because I want to have a natural look. Like we said before, I'd like to fight the aging process a little bit.
Right.
But I don't want to look unnatural. And that is something I really love about this office. They're about looking natural. They don't want people to be overdone.
Right.
And I feel very happy with the result that I got.
So it's just you, only better.
Well, thank you. Yes.
Well, Penny has some photographs today, so we're
Yes.
going to see some
Okay.
before and afters.
I didn't realize how I looked before, but I almost hate to show you all this. So this is before, and this is after. So there is a big difference when you look side by side. But like for the friends that I saw this weekend, they weren't quite sure, couldn't quite put their finger on it. But of course they were complimentary, and it made me feel great. And of course I told them what I did.
Yeah.
And they're all excited about it now, looking into it.
Oh, yeah.
Yeah.
Yeah, I was going to say that's my next question is, would you recommend this procedure to a friend?
I definitely would. I'm 55 years old, and sometimes, when I was thinking about doing it, I thought, am I too young? Should I wait? And this is really the time to do it. I feel like I just picked the perfect time. And, I've retired recently, so I'm going through lots of changes in my life with a new part-time job, and I'm just feeling great. I think this was a good time to do it. And when I see my before picture, I'm certain it was a perfect time to do it.
Yeah, this is a perfect time. So I think it's a new concept of don't wait till you're 80, maybe, when
Right.
you've got the wrinkles, and then you have to do something maybe more drastic.
Right.
But sort of ease into it
Right.
Before anybody really notices
That's right.
that you're...
And they say that the results can last for 1 to 3 years.
Oh, okay.
So, and then again, you can, in 1 to 3 years, you can go back and do this again. And it's not dramatic, like going under the knife.
Right. Absolutely.
Yeah.
Yeah. So tell me about why you chose Dr. Bowen.
Well, I picked Dr. Bowen because most of you watching, I'm sure, have heard about her. Long before I met her, I had been hearing about her reputation. And of course, there was nowhere else to go. This is the place I wanted to be. She did a talk a few months ago about the YLift, and I was interested. And I came and listened, and I thought, why not me? At first, I thought, well, I'm not sure. But I never really thought I would do a facelift. But this is something that is doable.
Right.
It doesn't take you out of your life. It doesn't make you look like a different person. And so it was just exactly the right thing for me. But she has a great reputation, and I can't say enough about how she wants people to look natural. And certainly she does so many things. It's not all cosmetic.
Right.
And people just rave about her. And her staff. I've got to say her staff is incredible as well.
Yes, her staff is wonderful. She's got a very holistic, natural approach, meaning the whole person.
That's right.
Wellness. So she's really about keeping things wellness and the whole person,
Right.
and natural, like I said, you, but only better.
Thank you.
And she does that on the other side of her practice with the centered on wellness.
That's right.
And she, I think, incorporates that same attitude with Golden House Center for Plastic Surgery. So we're so glad that you're here,
Thank
and
you.
thank you so much for being here and sharing
Absolutely.
your story and your procedure. And you look amazing.
Thank you.
And,
I feel great.
yeah. Well, thank you so much.
You're welcome.
Hi, welcome back to Golden Owls TV. I'm here with Dr. Bowen, and we are going to discuss the YLift procedure after the procedure. We just talked with Penny, and now we're going to talk to Dr. Bowen about the procedure. How did it go?
Everything went just great. Penny was a trooper and did very well as we did the procedure.
Good. So you were saying it's not needles, but it's cannulas. Tell me about that.
So cannulas are blunt on the end. So they are not cutting tissue as you're going under the tissue. They're sort of tracking through natural planes. And so that's one of the advantages of the procedure, is that because it's blunt and it's not cutting the tissues underneath, then you will have less bruising and, less chance for bruising and less swelling. And it makes it safer too, obviously.
Yes. Well, Penny's very pleased with the results. She looks amazing, and she said it was really easy, no problem. And tell me, who would be a candidate for the YLift procedure?
A good candidates range in age from, someone in their 20s if they have some structural issues, all the way up to someone who's healthy and hale in their 80s. I think it's more not so much about age. I think it has to do with what are expectations. So if you are looking just to look like a better version of yourself, this would be a very good procedure. It does not make someone look otherly, sort of like a lot of people will tell me about Kenny Rogers. I don't want to look like Kenny Rogers does, or some of those other Hollywood stars that have had like major plastic surgery and they no longer resemble themselves. They look something different. So most people in our community just want to look like a better version of themselves. And I think that's pretty much a normal thing. And so this does this. It is subtle, but yet very powerful. As you saw in Penny, I think just getting back a really strong, crisp jawline is a visual cue of sort of health and vitality. And that's how our faces are basically like weather vanes and sort of indicate to others where we are in our age, but also how we are in our health. And so if someone has a weak jawline or a weak chin, or sort of, marionette line, sort of a sad frown, then people either think, well, that person is either sad or mad or unhappy or unhealthy. And so I think getting that nice crisp jawline, getting a chin that is properly projecting in proportion to the face, getting lips that are soft for women, getting cheeks up, all of those things indicate sort of health and vitality, and that's what this procedure allows us to do.
Absolutely. Well, it's a wonderful procedure, and we thank you so much for allowing us to come in and go through the steps with you and learn about the YLift, and we're just so thankful. Thank you.
Well, thank you, and it's my pleasure that you guys did come and do this, because I think it's helpful when things are new, people are uncomfortable, is this the right thing for me? And I think that one of the reasons why I adopted the YLift, which was founded by Dr. Trokel, is because it accomplishes rejuvenation in a natural way and in a safe way with almost instant results, and you can't beat that.
Dr. Bowen, tell me, what is the best way for somebody to get in touch with you?
Certainly the best way is just to give us a call. So 634-1993. And if you call that number, then you'll be able to reach Angela, who is our patient care coordinator. And then once you get your appointment that fits into your schedule, you'll be getting another call from Noelle or Megan, who are other patient care coordinators, who will reach out and figure out how to make the consultative process the most informative and the most helpful. And also help that you be prepared to make this the best consultation so that we can help you achieve your goals.
Absolutely. That sounds great. Well, thank you so much for your time today.
Oh, well, thank you too.
We really appreciate it.
Okay, appreciate it.